Hello. So let's talk about HPV and cervical cancer. Human papillomavirus virus, or HPV, is a common virus that can cause cancers later in life. HPV infections are very common. Nearly everyone will get HPV at some point in their lives. About 13 million Americans, including teens, become infected each year, and more than 42 million Americans are currently infected with HPV types that can cause diseases. HPV is spread through intimate skin-to-skin contact. You can get HPV by having vaginal, anal, or oral sex with someone who has the virus, even if they don't have signs or symptoms. Most HPV infections, 9 times out of 10, go away by themselves within 2 years. But sometimes HPV infections will last longer and can cause some cancers. HPV infections can cause cancers of the cervix, vaginal, and vulva in women, the penis in men, the anus in both men and women, the back of the throat, including the base of the tongue, and tonsils in both men and women also. Every year in the U.S., HPV causes 36,000 cases of cancers in men and women. Cervical cancer. Cancer is a disease in which cells in the body grow out of control. Cancer is always named for the part of the body where it starts. When cancer starts in the cervix, it is called cervical cancer. The cervix connects the vaginal, which is the birth canal, to the upper part of the uterus. The uterus, or the womb, is where a baby grows when a woman is pregnant. Women are at risk for cervical cancer. It occurs most often in women over age 30. Long-lasting infection with certain types of HPV is the main cause of cervical cancer. Cancer usually takes years, even decades, to develop after a person gets HPV. There is no way to know who will develop cancer or other health problems from HPV. Now, let's discuss a way that we can prevent HPV infections, which will ultimately reduce our chances of cancer. The HPV vaccination can prevent over 90% of cancers caused by HPV, as well as anal, vaginal, cervical, and vulvar precancers. 3 HPV vaccines are approved for use in the U.S. The only one currently in the U.S. is Gardasil 9. The others are available in other countries. HPV vaccines work best when given at age 11 to 12 years old, before contact with the HPV virus. Girls and boys aged 11 to 12 should have 2 doses, 6 to 12 months apart. The series can be started as young as age 9. Older teens and young adults up to age 26 who aren't already vaccinated after age 15, 3 doses are necessary. Adult men and women ages 27 to 45 who aren't already vaccinated and who haven't specified risk as determined by their doctors. Pregnant women are also recommended to wait to have the HPV vaccines. If individuals who had a reaction to the vaccine, they're sick or ill individuals, or they're allergic to yeast, they should not take the vaccine.